There, they're coming in now. Understanding Medicare. Yes, exactly. And so that's what we're working on today. Medicare is a large program, so a lot of what we're going to go over today is really just touching on the surface, the very basics, and there's a lot more to learn, and we do have separate sessions where we go hours and really days into a lot of these different pieces of Medicare. So I just want to give you that kind of heads up that we're going to touch the basics just so that you have an awareness and understanding, but a lot of what we're going to go over, there is additional information to go deeper into any of these particular topics. And because it is a large program, as I mentioned, we're covering day one here, and we'll go into basic definition of what is Medicare, what do we mean by Part A, what do we mean by Part B, also Medicare enrollment, and we're going to talk a little bit about Medicare supplement insurance or Medigap policies. And if you're one of those individuals who have joined us who have more than the first 5 years of Medicare experience, you see there's some topics here that aren't included today because we're going to cover those today, or tomorrow, excuse me. So tomorrow we would jump into Medicare Advantage, coordination of benefits, and prescription drugs. So just kind of give you a layout of what we're hoping to cover today, and then also if a heads up about what we'll be going into tomorrow. Okay? And so let's start at the very beginning with a definition of what is Medicare. What are we talking about? And it's a federal program. It's health insurance for 3 categories. So those that are 65 or older, those under 65 with certain disabilities. And what we mean by that is that Social Security Administration has been giving Social Security disability insurance, so sometimes you'll hear that called SSDI. They've been getting benefits for 24 months. And then on that 25th month, you would be enrolled and eligible for Medicare. There is a sub-bullet that you can see on your screen. There are some diagnoses that we don't require that 24-month waiting period. So ALS, also called Lou Gehrig's disease, for example, would be one of those that you would be eligible for Medicare immediately without waiting for those 24 months waiting period. And then at any age with end-stage renal disease. You'll see this abbreviated throughout as ESRD. So if I do slip into acronym speak, forgive me, I will try to make sure that I say them all out completely, but there is an acronym sheet at the end of this presentation that might be helpful as a quick reference. And so these are the 3 categories of people that are eligible for this health insurance. And just an explanation for end-stage renal disease, what we mean is that they're in permanent kidney failure. They've been diagnosed with kidney failure, and they need a dialysis or kidney transplant to sustain life. You can see also the note on your screen that you need to be in a lawful status in the U.S. to qualify for Medicare. And what we mean by that is have your green card and then also having resided in the U.S. for 5 continuous years prior to getting Medicare. Okay, so if you've immigrated, you can still be eligible for the program, but you have to meet those 2 requirements. And then also pictured on your slide, just want to highlight, especially for those that are new to the program, this publication, Medicare and You, as you can see, it's updated every calendar year. It's a CMS product number. And you can find it on Medicare.gov along with a lot of other very helpful publications. However, this one is consumer tested, it's written in plain language, and it's really helpful for those that are just getting started with Medicare to understand the different parts and how the program works. So if you don't have or aren't aware of that publication, you can save it as a shortcut on your desktop, and it just helps you discuss with people with Medicare or people have questions about Medicare very quickly. All right. So what agencies are responsible for Medicare? And you might be surprised to learn that it's not just one, it's a group effort. So the first left side of your screen, Social Security, they enroll most people in Medicare. And so that is important to know. You want to make sure that anytime you move, you're updating your address with Social Security because they're doing the Medicare enrollment. The Railroad Retirement Board, or RRB, is responsible for enrolling those that work for the railroad or who have retired from the railroad. So they handle your enrollment for Medicare because they have your work history. And we'll get into that, why that's important a little bit later, but you can see on your slide, it's enrollment and then premium. So your work history affects the amount of money that you're going to pay for your premiums in Medicare. And then after someone's enrolled in the program, then here at the Centers for Medicare and Medicaid Services, or CMS, we administer the rest of the program. And that means coverage, benefits, payments, just overseeing any Medicare administrative contractors, or MACs, sometimes you'll hear them referred to, surveying, nursing homes, looking out for fraud, all those types of activities around the Medicare program, that falls with the Centers for Medicare and Medicaid Services. Now, sometimes you'll hear Medicare referred to as parts, the parts of Medicare. And so let's take a look at what we mean by that. So Part A is known as hospital insurance, and Part B is medical insurance. And we're going to do deeper dives into this beyond this introductory slide. But just know that Part A and Part B, a lot of times those two parts are referred to as original Medicare. Okay, so we have hospital insurance and medical insurance, and together they're called original Medicare. Then let's skip Part C for a moment and just know that Part D, as in dog, stands for drug coverage, right? So if you have Part A or you could be eligible for drug coverage and pick up Part D. Now we're skipping C for the moment, but just for awareness of why it looks like it's missing, right, from our alphabet, C is also called Medicare Advantage, the Medicare Advantage plan. So we're going to focus more on Medicare Advantage tomorrow. You'll hear a little bit of it come up as we talk through some of these other pieces. But for today, we're really going to focus on the original Medicare piece, so Part A and Part B. So let's take a closer look at what we mean by hospital insurance. And the reason that we kind of can refer to it as that is because when you say that inpatient is a classification. It's a specific way that your doctor has admitted you to the hospital. So it's not just that you've gone to a physical location at the hospital to receive services. It's actual an admittance from your doctor, an official order that says you need 2 or more midnights of medically necessary care to treat your illness or injury, and it's the only type of care you can get in a hospital. So then the hospital will formally admit you, and of course for Part A, the hospital would have to accept Medicare as insurance for payment. And the final requirement is that the Utilization Review Committee of the hospital approves your stay while you're in that hospital. Part A also covers inpatient skilled nursing facility care. Sometimes you'll hear this abbreviation at SNF, called SNF. And so inpatient skilled nursing facility care is covered by Part A if you meet certain criteria. And you can see that there is a 3-day inpatient hospital stay for your Medicare Part A to cover skilled nursing facility care. And this is under normal circumstances. Currently, there's been a public health emergency declared for about 2 years now. It was just renewed, and because of the COVID public health emergency and its effect on some of the hospital capacity, this current rule has been waived. So if you meet certain conditions, this 3-day inpatient hospital stay can be waived as long as the public health emergency is active. And there's more information in the notes and links that you can go to keep updated on the different COVID-19 emergency declarations. And so for an example, if you had Part A and you need a hip surgery, you would be formally admitted by your doctor into the hospital for your surgery. And let's say the hospital kept you there for 3 days. And then after that, you needed physical therapy at a skilled nursing facility. You weren't quite ready to go home yet. After that 3-day inpatient hospital stay, then Part A is going to also cover your rehabilitative services in the skilled nursing facility because you've had that 3-day requirement. And it's important to know that skilled nursing facilities, the type of care that Medicare Part A will cover is things like licensed practical and vocational nurses, physical and occupational therapists, speech-language pathologists, and audiologists. So the expectation with these types of skilled care is that you're going to have an improvement or get better. And what Medicare Part A will not cover is considered custodial or long-term care. So this is the type of care that somebody might get in a nursing home, in which you need help with daily activities of basic living. And so that is an important distinction to realize when we're talking about skilled nursing facility care. It's that rehabilitative care that with the expectation, for example, after hip surgery, the physical therapy, that you're going to improve and then be independent with time and the therapy. So now we know what the inpatient care, what we mean by inpatient care covered under Medicare Part A. How do you pay for it? What's the cost? And it's important that to know that most people don't pay a premium for Part A. And what we mean by a premium is a monthly amount that you pay to have the insurance, right? And the reason that most people don't pay a premium for Part A is because they've already paid it through Federal Insurance Contributions Act, or FICA taxes. If you have, if you're employed through a covered job and you look at your pay stub, you'll see a FICA tax, and that tax goes to paying your Part A premium. And you qualify for what we call free Part A, meaning there's no premium, if you've worked for at least 10 years. You could also qualify based off of your spouse's work history. So if you or your spouse have worked for at least 10 years, then you would get what we call premium-free Part A. And that covers most of the people with Medicare. In fact, about 99% of people with Medicare don't pay a Part A premium since they've worked at least 40 quarters or 10 years. However, if you haven't worked 10 years or you can't qualify under a spouse's record, you can still choose to get Part A, but you have certain timelines when you have to enroll and you have to pay for it. So if you're not eligible for the premium-free Part A, you can buy it. If you can buy it, and these amounts change yearly. So in 2022, the Part A premium for a person who's worked less than 30 quarters is $499 per month. And those who have worked between 30 and 39 quarters of coverage have a reduced monthly premium rate, which is $274 for 2022. And again, these numbers are updated every calendar year. And those amounts are in your notes if you're looking at where I'm pulling them from the slide. So you do have them in your notes section. And I also mentioned that if you have to pay for it, right, which is a very small percentage, then you have to enroll on time. You have to first get Part A as soon as you're eligible, right? We talked about whether you're 65 or older, if you're under 65 and have a disability. So you need to enroll when you first are eligible for Part A, or you could pay more, what we call a late enrollment penalty. And so that's that last bullet on your slide. If you need to pay for Part A and you don't enroll on time, then you're going to have a late enrollment penalty of 10%, and it's going to last for twice the number of years you could have had Part A, but you didn't sign up. So, for example, if you were eligible for Part A and you had to pay for it, but you didn't enroll for a year, a full year, 12-month period went by, then you're going to be paying that higher. When you do enroll in Part A, you're going to pay the higher premium for 2 years, okay, 2 times 1, for as long as you could have had Part A, but again, didn't sign up. And it's also important, and we'll go into a little bit more detail later, but there are limited income and resources programs to help those with limited income and resources. So your state is a good resource for that. Also, Social Security might have more information about resources for help paying your Part A if you qualify for certain programs. So in addition to the premium, so we said most people for Part A aren't paying a premium because they already worked. If you do have to pay a premium, and we just went over those amounts, but when you actually use services that are covered under Part A, so when you are admitted as an inpatient hospital stay, there are some other payments out of pocket. The first is a $1,556 deductible. And a deductible is an amount that you have to pay first before your insurance company kicks in. And again, these amounts are current for 2022, and they are updated every year. So make sure that you're just looking at, for the latest information, using the links that are provided in your notes to see the Medicare amount. And it goes for 1 through 60, days 1 through 60 of each benefit period. And we'll explain benefit period more clearly on the next slide. But then you can see that the cost of a coinsurance increases beyond day 60. So after day 60, then you're going to have a copayment of $389 per day for days 61 through 90 of each benefit period. And then the tier beyond that is the $778 per lifetime reserve day after 90 days of each benefit period. All right, so that's the cost for the inpatient hospital stay. We also talked about the skilled nursing facility care that Part A covers, and again, it has a different breakdown. So it's $0 for the first 20 days of each benefit period, and then beyond day 21 is when the copayment comes in. For that service, it's $194.50, and then all costs beyond the 100-day benefit period. So the three other pieces that fill out that chart for what's covered by Medicare Part A are home health care services, the hospice care, and the blood. We are going to go through those individually too in just a moment. But let's first pause and explain what we mean by per benefit period, right? So a benefit period is a way that Medicare measures your use of inpatient and hospital services. It's going to begin the day that you're admitted as an inpatient, member formally admitted as an inpatient by your doctor. And then it ends when you haven't gotten any inpatient hospital or inpatient SNF care for 60 calendar days in a row. Okay, so that's one benefit period. You need to pay a deductible for each benefit period. You can see, we talked about the cost on the previous slide. You can see why it'd be important to know how often or how frequently you might have to pay that deductible. There's no limit to the number of benefit periods that you can have, and they can span calendar years. Okay, so let's go back to the example that I used earlier in explaining if I needed hip surgery and I had Medicare Part A, then my doctor could admit me to the hospital to get my surgery. Right? That day that I'm admitted as an inpatient by my doctor would be the start of my benefit period. Okay, it doesn't matter if it happens December 15th, that's the start of my benefit period, right? And I have my surgery. I then go into my skilled nursing facility because after my 3 days of inpatient hospital care, I get my physical therapy at the skilled nursing facility, and I'm sent home, right? I'm sent home before the end of the year, before December 30th. Let's say come January, the first week of January, I'm having complications. Something's wrong. Maybe the incision isn't healing right. I have to be readmitted as an inpatient to the hospital for that related condition. I don't have to pay a deductible because I haven't been home and not receiving care for 60 days in a row. Okay, I'm still within that 60 days and it's still the same injury. So in that case, I would not have to pay another Part A deductible, and even though it's crossed from December into January. So I hope that example helps you kind of sort out the benefit periods and why, again, could be very confusing to somebody who needs to understand when and how often they might have to pay that deductible. It's also important for those in Medicare Part A to realize that your hospital status is going to affect how much you're going to pay out of pocket, and depending on which parts of Medicare you have, what it's going to cover. So we talked about earlier, for Medicare Part A to cover your services in a hospital, you have to be formally admitted as an inpatient in that hospital, which means your doctor has issued a formal order and said they're going to need at least 2 midnights of care, right? That's the 2 midnight rule. However, what can happen, and what sometimes confuses people with Medicare, is that you would go to the hospital with an ailment or a complaint, and so you're in the hospital, but you might be what they call under observation. So even though that you're in a hospital and maybe you spent the night in a hospital, if your doctor still has you in an observation status, meaning they're not sure if you really need those 2 midnights of care, they're just watching you to see, Part A is not going to cover costs if you stay in an outpatient status or an observation, okay? That's not covered under Part A. Only inpatient care is covered under Part A. So if you only have Part A as your hospital insurance, it's not covering anything until your doctor formally admits you as an inpatient. And because that can be, a significant amount when you're in a hospital and getting services, if your Part A is not covering it, you can imagine that it would be a large outpatient cost, or I'm sorry, out-of-pocket cost. The hospital is required to notify you. So it's called a Medicare Outpatient Observation Notice, and it's abbreviated as MOON. And so that is required to be given to a patient when they're in observation status for longer than 24 hours, right? So they've been in there really 2 days, but their doctor hasn't yet admitted them as an inpatient. And they have to be given that before the 36th hour, okay, that MOON notice. Right. What's also important to know is when you're in this observation status, your doctor can, after a certain period of time of the observation status, make the determination to now formally admit you as an inpatient, right? The doctor is making an order. For that, your Part A can be retroactive, meaning it's going to go back for up to 3 days and will cover the observation status, okay? Now, if you never are formally admitted in an observation, Part A doesn't cover it. But if you are formally admitted as an inpatient, Part A will go back up to 3 days and cover the observation status. However, there is a difference for the skilled nursing facility piece we talked about in non-pandemic health emergency times. There's a 3-day inpatient qualifying hospital stay requirement. This rule does not apply to that requirement, so it would not be retroactive for the requirement of skilled nursing facility stay. But at the moment, because we're in a pandemic and under a public health emergency, that rule is currently waived if you meet certain requirements. Okay, so important distinction between getting services at a hospital and the difference between being an inpatient and formally admitted versus an outpatient or in observation status.
Okay, so now we're going to move into home health care coverage, which is also covered under Medicare Part A. And this slide's pretty straightforward. We're going to talk about what is covered and what is not covered under original Medicare for home health care. So things that are covered: intermittent skilled nursing care, physical therapy, any kind of speech-language pathology services, continued occupational services. It might also include some medical social services or possibly some part-time home health aid services, any kind of medical supplies that you need if you're, at home, durable medical equipment, and then sometimes, if needed, injectable osteoporosis drugs. And usually there's a home health care agency coordinator who helps manage all of this and, coordinates with the doctor's orders as to making sure that you're getting those services and you have what you need for home health care. Things that don't or are not paid for by original Medicare: 24-hour-a-day care at home, meals delivered, homemaker services, personal care, and, some of these services you may have heard for people that are under Medicare Advantage plans. They may have some additional services under those plans, but it can vary, and it's really always important to check with Medicare Advantage plans to see, what exactly they do cover. Okay, there are 5 required conditions for home health care coverage. And you can see here, they're listed on your slide, but I'm going to go into a little bit more detail. So, you must be homebound. What does that mean? It means that a doctor actually certifies that you're homebound. And it could mean things like you have trouble leaving your home without help, like maybe you need a wheelchair or a walker or crutches, or the help of another person because you've had some kind of illness or injury and you really shouldn't be leaving your home because of your condition. So that's one. Maybe you're normally unable to leave your home, but if you do, it requires a major amount of effort. You might leave your house for things like a medical treatment, or there are some things that you can leave or that you do leave your house for that are non-medical, like a funeral, graduation, maybe you just need to get out of the house for a walk, things like that. Number two, you must need skilled care on a part-time or intermittent basis. And this could include skilled nursing care, or it could also include things like physical therapy, that speech-language pathology, or that continuing occupational therapy. Number three, you must be under the care of a doctor. So you must be getting services under a plan of care that the doctor created for you and is regularly monitoring and reviewing. Number four, it says you must have that face-to-face encounter with your doctor. So this could include a doctor or maybe another health professional like a nurse practitioner, and they must document that they've had that face-to-face contact with you, like an appointment in their office. There are some telehealth flexibilities for this as well. And also, it has to be within required time frames. So it must be done up to 90 days before or within 30 days after the start of care. And then number five, these services must be from a Medicare-approved home health agency, must be certified by Medicare. Another thing I'd like to mention is that Part B may also pay for home health care under certain conditions. While we are presenting this under Part A, and most of these things that we're talking about are covered under Part A, there are examples like Part B would pay if an inpatient hospital stay doesn't come before the need for home health care, or maybe when the number of Part A covered home health visits have gone above 100. Okay, so how do we pay for home health care? In original Medicare, you pay nothing for Part A covered home health care services that are provided by a Medicare-approved home health agency, and 20% of the Medicare-approved amount for durable medical equipment. And that durable medical equipment must be ordered by a doctor, it's paid separately by Medicare, and it must meet certain criteria. So usually Medicare pays the 80% of that Medicare-approved amount for certain pieces of equipment like wheelchairs and walkers, for example. If your home health care agency doesn't supply the durable medical equipment directly, then usually that home health care agency staff will arrange for that supplier to bring the items that you need to your house. Medicare pays your home health agency one payment for covered services that you get during a 60-day period. And this is what we call an episode of care. I know Kim was talking about benefit periods, and now we're talking about something else called an episode of care. So some of these terms may be newer to you, but these are different time frames that we go by. And this episode of care is based on your condition and your care needs. You can find home health care agencies in your area by going on our website, medicare.gov, under Care Compare, and you can actually search for agencies that are, nearby.
So we have Edgar. He's getting Medicare-covered home health care. Well, on Monday, his daughter took him to a doctor's appointment. On Sunday, she took him to church. On Wednesdays and Fridays, he is picked up for adult daycare. As long as he meets the other requirements to get home health care, he still qualifies for home health care coverage, even though he was able to leave his house. And that is true. We have it marked there. We want to make sure that you understand why. As Carrie mentioned, you can still be eligible for home health care coverage through Medicare, even if you can leave your home for medical treatment or for short, infrequent absences for non-medical reasons. And the example she gave was like attending religious services or going to an adult daycare. So those are still allowed even though you're under Medicare home health coverage. All right, Carrie, back to you for hospice care.
All right. Okay. So obviously, hospice care since we've been talking about Medicare Part A, is also covered under Medicare Part A. And hospice care is a special way of caring for people who are terminally ill, and it also supports their families. It's usually at their home, or it could be in a facility also that the person would live in. Medicare does cover short-term hospital care when needed while a person's in hospice, but hospice is really meant to help the person make the most of their last months by living their life in comfort and generally, without pain. So that pain is a big piece of the care that they're given. It involves a team that addresses many different aspects of a person's health. So not just medical, but physical, social, emotional, spiritual needs. And it's really, again, to care for the person and their family and not to cure the illness. So there are some requirements, as we mentioned with the other services. You must sign an election statement choosing hospice care instead of routine Medicare covered benefits to treat your terminal illness. The medical services are not related to your condition would still be covered by Medicare. So it's really the hospice care is addressing that specific area of which, the reason for why you're in the hospice care, but don't worry, if you have other things that come about while you're in hospice, Medicare is not going to limit that. They're going to cover those other things that need to be covered. Your doctor must, again, certify that you're terminally ill and have probably less than 6 months to live. Care is given in election periods. So I know we've talked about benefit periods and episodes of care. Now we're going to talk about election periods. These are 2 90-day periods followed by unlimited 60-day periods. And all of this is stuff you can, obviously refer to, but I just wanted to at least explain it during this portion of the webinar. At the start of each election period, your doctor has to certify that you're terminally ill, so in order for you to still get that hospice care. So it's just a way for them to check in, evaluate, and then recertify the person's illness. Medicare also does require face-to-face visits, so the doctor is required to meet with you within the 30 days of hospice recertification before the 3rd election period. And each time there's a recertification, the doctor has to meet with you. And as with the home health care agencies, hospice providers must also be Medicare approved. So what's covered under hospice? There's quite a list here. So in addition to Medicare covered services that are more routine, like doctor and nursing care, physical and occupational therapy, and speech language therapy, hospice also covers things like medical equipment, wheelchairs, walkers, medical supplies, catheters, bandages, anything that's related to your care in hospice like that. Drugs for symptom control and pain relief, short-term care in the hospital, at a hospice inpatient facility, or a skilled nursing facility when it's needed for pain and symptom management. So it's directly related to your illness. It also covers what we call inpatient respite care. And this is care that's given to you by another caregiver so that your usual caregiver can have a break. You'll be cared for in a Medicare-approved facility like a hospice inpatient facility or a hospital or a nursing home, and you can stay up to 5 days each time you get the respite care. There's no limit to the number of these times that you can have respite care, and Medicare also covers short-term hospital care when needed, as I had mentioned before. Other services that that hospice covers is a hospice aid and homemaker services, social work services, and other services that Medicare doesn't usually cover, like spiritual, grief, dietary, and other types of counseling. How do we pay for hospice care? Well, in original Medicare, you pay a copayment of no more than $5 for each prescription drug and or products related to pain relief or symptom control while you're receiving the routine care at home, and 5% of the Medicare-approved amount, payment amount for inpatient respite care, which I was just talking about. For example, if Medicare has approved a charge of $150 per day for inpatient respite care, you would be responsible for $7.50 per day. And that amount can change each year. But overall, you don't pay for the hospice care. So just keep that in mind, and it just kind of outlines those charges for prescriptions and that respite care. Room and board are only payable by Medicare in certain situations, and they're covered during the short-term inpatient stays that I just talked about. They aren't covered if you receive general hospital services while you're in a nursing home, like you're a resident there, or a residential hospice facility. If you are getting Medicaid and Medicare and you're in a nursing facility, then room and board are covered by Medicaid. Now I'm going to turn things back over to Kim, who's going to review some program basics for Medicare Part B.
Great. Thank you so much, Carrie. And I apologize. I was looking at some of the comments. There's a little bit of a lag in the slides. So I'm going to advance it now. And it's original Medicare Part B medical insurance should be what's on your screen. Certainly, if you have downloaded a copy of the slides and are following kind of on your own copy, then it's slide 23. Okay. So now that we've gone over the benefits that are covered under Medicare Part A, remember I said we were going to focus on original Medicare here today. So let's move on to the other half of original Medicare, or Medicare Part B. This is also called medical insurance. And if for Part A, if you focus on kind of a keyword, it was your hospital inpatient, right? It was the inpatient status that was important for Part A. So for Part B, it's natural to kind of do the opposite, right? Part B is going to cover outpatient services. So things like when you go see your doctor at his doctor's office, approved procedures like x-rays or stitches that you would get on an outpatient basis. Laboratory services, things like your analysis or blood tests. Durable medical equipment, this is referred to as DME. DEMI, sometimes people call it DEMI post to add prosthetics and orthotics. This is, things like canes and walkers, medical equipment. Medicare Part B also covers diabetic testing supplies and equipment, things like blood sugar test strips, blood sugar control solutions, therapeutic shoes or inserts are all covered under Part B. Part B also covers several preventive services, things like flu shots and yearly wellness. Home health care, Carrie just explained that home health care can be covered under Part A, but it can also be covered under Part B. For example, if somebody only has Part B and maybe they don't have Part A, for the Part B, it would also pay for home health care if an inpatient hospital stay doesn't precede the need for the home health care, or if they've exceeded their allowed visits under Part A covered home health care, which is 100. So in that case, Part B would cover home health care. Part B also covers medically necessary patient physical and occupational services, and then other outpatient mental health care services is covered by Part B. So let's take a break give our brains a little bit of a break from all those text for a moment and go back to some wuzzles. This is one of those outpatient services that can be covered under Part B. And so for Part B, unlike Part A, we said that most people get Part A for free, premium free rather, meaning they don't have to pay a monthly charge to have their Part A coverage. For Part B, it's the opposite. Most people do pay a premium, and that premium amount is updated every year. For this year, it's $170.10, and that's what we call the standard Part B premium. There are some that may pay a little bit more than the standard, and there are some that may pay a little less. Let's start with those that pay less, and that is due to a hold harmless provision. So there is a legal provision called hold harmless from Social Security which essentially says that people who get Social Security benefits, they can't have that increase, the Part B increase premium, to be greater than their Social Security benefits. So if that's the case, then they are held harmless and they would pay less than the Part B standard amount. Okay, that's a very small population this year for 2022. Now, there could be people that pay more than the standard Part B premium, and that could be due to their income. So we're going to talk about that just a moment on the next slide, on slide 28. But there also could be people that are paying what we call a late enrollment penalty. So for Part B, if you don't sign up for Part B when you're first eligible, you could have a late enrollment penalty, and this is going to last for as long as you have Part B coverage. So some people call it a lifetime penalty. So if you don't enroll in Part B when you're first eligible, your premium amount is going to go up 10% for each 12-month period that you could have had Part B, but you didn't take it. Now, there are certain exceptions. For example, maybe if you qualify for Medicaid, or you can enroll in a special enrollment period, which we'll talk about our enrollment periods in a moment. But it's important for people new to Medicare to realize that there are certain time frames for enrolling, and if they don't meet those time frames, they could have to pay more for their coverage. So let's take a look at the other category I referred to, and these are people that are, because of their income, are paying an amount higher than the standard Part B amount. So this is called the Income-Related Monthly Adjustment Amount, or IRMA for short, and it's based off of tax returns from the IRS 2 years ago. So for this year, for 2022, the amount is actually being determined from the latest full complete report that the IRS has, which is the 2020 tax return. So if we just follow this chart, you can see there's different columns going down based off of whether you file an individual tax return, a joint tax return, or then the married but filing a separate tax return. Those are the three columns. And then the very last column is going to say what you pay under those circumstances for these thresholds. So if you filed as an individual 2 years ago in 2020 and you made $91,000 or less, or if you filed joint $182,000 or less, then you're going to be paying the standard Part B premium, the $170.10 every month. However, if you've gone above any of those thresholds, then you move down to the second row, depending on what your reported income was. So you can see the next one is if you filed as an individual in 2020 and you made above $91,000 up to $114,000, then you're paying the next premium amount, which is $238.10. So this is Part B income-related monthly adjustment amount, or IRMA. Now, we know that things can happen from between the 2 years. So maybe if there has been something that has affected your income, that it no longer reflects what your 2020 tax return reported, and you're getting an IRMA notice. What we would encourage you to do is to contact Social Security, and they have a process that you can provide documentation. You know, maybe you were divorced and that income has now changed. For whatever the reason, you can file that paperwork through Social Security and ask for a redetermination of your IRMA. Certainly in the meantime, while you're waiting for those, you want to continue to pay your Part B so that you have your coverage, but there is a process to file if you disagree with your IRMA determination. Okay, and so there are some people that could pay this, and then if they also joined Part B late, they could also be subject to the late enrollment penalty. So those are the different reasonings for varying amounts for your Part B premium. Okay, so in addition for the premium, or the monthly amount that you're going to pay to have Part B, there is also deductible. Note that this is a calendar year deductible. So this is not like Part A where it's based off a benefits period. This is simply the beginning of the calendar year. You have to pay the first $233 for your Part B services before your Medicare coverage is going to kick in, okay? So then when you need services that are covered under Part B, if you've met that $233 deductible, then from there on out, essentially, Medicare Part B when you go to the doctors, Medicare Part B would cover about 80% of that service, and that would leave you with about a 20% coinsurance for most covered services. Now, I mentioned during the colonoscopy WUSL that there are some preventive services where there actually is not a coinsurance from the person with Medicare. But in general, for most Part B services, Medicare will pay about 80%, and then there's a 20% coinsurance for the covered Part B services. That would be your share of the cost. So a lot of people, they're choosing whether or not to enroll in Part B. And so these are some of the things that we just want people to consider and be aware of as they make these considerations. So most people are going to pay that premium. The way that they pay it, they have some options. It can be deducted directly from their Social Security or their Railroad Retirement Board benefit checks. As we mentioned before, the amount can depend on income. It can also depend on if you enrolled on time. Do you have a late enrollment penalty? For some people, you might have health insurance coverage already through another source, through a non-Medicare source, like an employer coverage. So if you are covered by your employer coverage, then your Part B coverage might duplicate some. They might coordinate. It depends on what type of coverage you have. So they could supplement and work together. Your Part B coverage could supplement your employer coverage. But if you don't have employer coverage, then Part B, unless you have another source, will mean that you don't have full health insurance. You don't have coverage for a lot of these services that are covered through Part B. So these are some things that we want people to think about in their personal situations, what choice is right for them in terms of their Part B decisions. Now, there are some situations where you have to have Part B. And for those who want to buy a Medigap policy, and we're going to talk about what that means in depth a little bit later on today, you have to have both Parts A and Part B to be able to buy a Medigap policy. And the same applies if you want to join a Medicare Advantage plan. That's sometimes called Part C. So you need both Part A and Part B to have the option to get either of those programs. Also, if you're eligible for TRICARE for life, then you have to have Part B, both Part A and Part B, to get the full TRICARE for life benefits. If you work at a small employer, meaning it has 20 or less employees, then when you're eligible for Medicare, then your employer coverage can tell you to go onto Medicare Part B. They're no longer going to cover you. So that would be a situation where you would have to get Part B in order to have coverage. Okay, and you can see there's a note on your screen, and I think tomorrow we go into a little bit more about what we call coordination of benefits, so how some health insurance coverages may work with others. For those, we talked a little bit about TRICARE for life and CHAMP VA on this slide, but there's also Veterans Administrative Affairs benefits, and those are separate from Medicare. So if you have VA coverage, then you would work through VA for what their services are, and you could choose not to enroll in Part B. So we just want to make sure that you're not confusing that TRICARE with the Veterans Affairs coverage. Okay, and we mentioned earlier when we were talking a little bit about the deductible amount for Part A per benefit period and some of the costs, out-of-pocket costs that are associated with original Medicare. For those with limited income and resources, we want you to have awareness that there are programs that are set up that can help with some of these costs. So there's also, you might have heard of Medicaid, which of course is a separate federal and state partner program that provides health insurance coverage for those with limited income and resources, right? That's a separate program, and the state and the federal government partner to implement that program. But there are also what we call Medicare Savings Program, and their income and resource guidelines are a little bit more generous than Medicaid. So if you don't qualify for full Medicaid coverage, we want you to be aware of these Medicare Savings Programs. There are different tier levels. You see them on your screen. And they can help pay for some or all of the costs. So the first is the Qualified Medicare Beneficiary Program. You'll sometimes hear this called QIMBY, and it's going to help pay for Part A and or Part B premiums, deductibles, coinsurance, and copayments. And these amounts, again, are updated each year, the resource and income amounts. I know that the federal poverty level for 2022 was just recently updated, and I did see like National Council of Aging had their Medicare Savings Program updated limits and resources, so you can find the 2022 amounts out online now for each of these programs. And the SureMedicare.gov will be updating theirs soon as well. The next program down, sometimes called SLIMD, is Specified Low-Income Medicare Beneficiary. That's only going to help with Part B premiums. And then the Qualifying Individual Program, or QI. Yes, I'm sorry. Can you hear me now, Melissa?
I can hear you. You just disappeared on us for a few moments.
I apologize about that. My phone line must have cut out.
Okay.
So I think I left off on the Qualifying Individual Program, which helps pay Part B premiums only, and this is a first-come, first-served basis. So you certainly will want to put the application in early so that you are within that first to get the assistance required. And then the last one is the Qualified Disabled and Working Individuals, or QDWI. And this is a program if you had a disability and then are returning to work. So the eligibility for that program, again, is determined by income and resource levels, but it's specific to that, those with a disability and who are working. And so the states and income resources, they might count them differently, so it's helpful to check with your state Medicaid office to find out which programs may be available to you and apply.
What I'm going to ask you when we go to each slide is the service on the slide covered by Medicare Part A or Part B? Okay, most of you seem like you're putting in the correct answer, which is B. Medicare Part B covers medically necessary doctor's care. Okay, how about medically necessary inpatient hospital stay? Is that Medicare Part A or Part B? All right.
I think we have a lag, Carrie. We're still seeing the doctor's care slide, so there's a little bit of a lag.
Okay, all right. Medically necessary inpatient hospital stay is covered by Part A. Routine eye exam, is that covered by Medicare Part A or Part B? All right. So the answer is that it's not covered by original Medicare. Medicare doesn't cover everything, as we know. Doesn't cover the routine eye exams, but also doesn't cover things like dental services, hearing aids, or cosmetic surgery. Those things I just mentioned may have some coverage if you have Medicaid or possibly a Medicare Advantage plan that covers those services. Okay. All right, the next one and the last one you should see is home health care. Go ahead and put in what you think. Is that Medicare Part A or Part B? Okay, it looks like lots are putting in A, but this one actually could be Part A and or Part B. Remember when I was talking about home health care, it's generally covered by Part A, but remember Part B can also pay for home health care under certain conditions, like if the person didn't have an inpatient stay before the need for home health care, or if the number of visits they've had for home health care is above 100. Okay, so just keep that in mind. All right, and the next slide is actually going to take us into appeals and when can you appeal. And we're going to give Melissa just a moment. She's going to be pulling up a video, and we'll give her a moment to do that. But while she's doing so, I'm going to just discuss briefly about the 5 levels of appeals, and that basically there's a different process for appeals for Part A and Part B, Part C, Medicare Advantage, and Part D. And on your slide, there is a very teeny tiny chart that talks about the Medicare appeals process comparison chart. And this chart is not meant for you to actually see right now, but just to get you familiar with the fact that it exists and that you can download the full-size chart with the link that's on your slide. How and when you can enroll in Medicare. And so as you can see, Medicare enrollment rules and decisions can vary depending on some things that we're going to talk about now. If you get Social Security Disability Insurance, or SSDI, Social Security retirement benefits, or railroad retirement benefits, you're age 65, or it also could depend on, are you getting other insurance coverage from your employer? So why is enrolling on time important? If people don't enroll on time, obviously here, costs could be higher, there could be some late enrollment penalties, or they could possibly pay more for a Medigap policy or Medicare supplement insurance. The Part B and Part D penalties can last as long as you have Medicare Part B or D. If you're eligible for Part A and you have to buy it, and you don't get that when you're first eligible, that monthly premium may go up 10%, and you have to pay that higher premium for twice the number of you didn't sign up. Also, your coverage might be affected, like having a gap in coverage or a waiting period because of a pre-existing condition, so for instance with Medigap. And then you might not be able to buy a Medigap policy or might have to pay more. So these are all things that could happen if we don't pay attention to the enrollment timeframes. And we'll, again, be discussing more about those. All right, so sometimes Medicare enrollment is automatic. But I want to talk about when Medicare enrollment is automatic. So when you have Social Security benefits and railroad retirement benefits, okay, if you're already getting those during your initial enrollment period, for example, you get retirement benefits at least 4 months before you turn 65, you'll be automatically enrolled in Medicare Part A and Part B. You'll get your Welcome to Medicare package. As you can see on your screen, there's a publication there. That's a very good resource. And that includes also your Medicare card and other information about, you get them about 3 months before you turn 65. And coverage would begin the first day of the month you turn 65. If you're under 65 and have a disability, you'll automatically get Part A and Part B after your disability benefits from Social Security or certain benefits from the Railroad Retirement Board for 24 months. If you have ALS, you'll get Part A and Part B automatically the month your Social Security disability benefits begin. So depending upon your situation, will depend on when the benefits begin. All right, so let's jump into a little bit more about your Medicare card. So you see here on your screen, hopefully, oh, it's changing again, a picture of the Medicare card, and this is what we sometimes refer to as the red, white, and blue card. And if you happen to join a Medicare Advantage plan, your plan may give you a card instead to use. Your Medicare Advantage plan ID card would be the main card, but it's important to always keep your red, white, and blue Medicare card or original Medicare card with you because you might sometimes have to show that in addition. All right, so Melissa, I'm not sure if you're able to reset the slides. It seems to be moving on its own at this point. Okay, so the Medicare card, the red, white, and blue card, shows the type of Medicare coverage you have and the date your coverage started. So it'll show if you have Part A or Part B or both. Your Medicare card's number has a unique combination of letters and numbers. They are created to protect your identity. So you may recall many years ago, not too many years ago, but several years back, the security numbers were on the card, and that has since been removed, and now we use this unique combination. If you get your Medicare card and you don't want Part B, there are directions on the back that you can return the card and say that you don't want Part B, and Medicare will send you another card showing that you only have Part A. And there's different reasons for why you may do that. Maybe you still have employer coverage or something like that. It's very important to keep that Medicare number protected. Only give it to doctors, at the pharmacy, other healthcare providers, or other insurers. You may also, just another thing I want to point out, get your Medicare number or print another official copy of your card by visiting Medicare.gov. You can go to your account, set up an account if you don't have one, and log in. You can print your card out. Okay. If you don't get enrolled automatically, you must take action. Okay, so how do you do that? Well, you'll need to enroll with Social Security by going to socialsecurity.gov, or you can call them at 1-800-772-1213. If you're retired from a railroad, you would enroll with the Railroad Retirement Board. You can call your local office for that. The other thing I want to mention is that a Welcome to Medicare package, like I mentioned before, for those people who are automatically enrolled, it's automatically sent. But once you actively enroll, you have to do it on your own, then you would be mailed that Welcome to Medicare package about 2 to 3 weeks after you apply. All right, so that would contain the start date of your coverage, the Medicare card, brochure, so you can have some basic information just a few weeks later.
Great. Thank you so much, Carrie. And for those following along in the presentation, we're at slide 47. And as Carrie, she just went over, some people are automatically enrolled, some have to take an action. But even if you have to take an action, you can't just pick any time of the year. There are certain time periods, or what we call enrollment periods, to not only get Medicare initially, but also after you already have Medicare, when you can make changes to your coverage. So first, if you don't already have Medicare, you can get it during your initial enrollment period, during a general enrollment period, and during a special enrollment period. And there, of course, as the name implies, there are special circumstances to see if you qualify for what we call an SEP, or special enrollment period. And then after you have Medicare, then there are certain different enrollment periods that are times for you to make changes for your coverage. So we have a yearly open enrollment period, and sometimes you'll hear this called the OEP, that happens in the fall. And we're going to go into each one of these in detail in just a moment. There's also the Medicare Advantage open enrollment period that applies if you have a Medicare Advantage plan. There's a 5-star special enrollment period, and then there are other qualifications or situations that could put you in a special enrollment period. So let's take a closer look at each one, moving on to slide 48, or the initial enrollment period. And this is as the name implies, your first chance to get Medicare. And I would say it's almost the most important one, because if you enroll when you're first eligible, you're not going to get any late enrollment penalties that we had talked about earlier with Medicare Part A if you have to pay for it, or Medicare Part B. So because this is your first opportunity to enroll, you would get it right then and not be subject to any late enrollment penalties. And so this is a 7-month period around your 65th birthday, because, right, we said that people 65 and older are eligible for Medicare. So it starts 3 months before you turn 65. It includes your birthday month, and it includes 3 months after you turn 65. So that's the 7-month period. And your coverage is going to start, or depend rather, on when within that initial enrollment period you enroll. So if you enroll in the first 3 months, so 3 months before you turn 65, then your Medicare coverage is going to start on the first day of your birthday month. If you enroll during your birthday month, then your Medicare coverage starts on the first of the next month, And then if you enroll in the 3 months after your birthday, then your Medicare coverage will be delayed 2 to 3 months. And again, remember, when you enroll, you're contacting Social Security Administration because they're the ones that process Medicare enrollment for most people, unless you've worked or retired from the railroad, in which case it would be the RRB, or Railroad Retirement Board. All right, so that's your first chance to join Medicare. Now, moving on to the next slide, which is slide 49, this is for making changes. So if you've already have Medicare, then every year you get an open enrollment period to make changes for your coverage, which then takes effect the following calendar year. So for October 15th through December 7th, every year, if you have Medicare, you can make changes. And you can join a Medicare Advantage plan if you want. You can switch which Medicare Advantage plan you have, or you can go from original Medicare to a Medicare Advantage plan, or back the opposite way. So if you're in a Medicare Advantage plan and want to return to original Medicare, you can do that. So all these different changes that you can make to your coverage, again, it's a special time of year for those changes, and then any of those changes would apply the first of the following year. Now you can see the note the note that's on the slide will say no new late enrollment penalties. And why we're saying no new ones is because this is just the time to make changes, right? So if you already had a late enrollment penalty, that doesn't go away, but you wouldn't get any new ones, right? Because we're just making changes to how we get our Medicare coverage. And we have the opportunity to do that each year. And each year we do encourage people with Medicare to look on the Plan Finder and see if there are other plans or coverage options that might work better for them, depending on what prescriptions they have and what their medical needs are. Then on slide 50, it's actually occurring right now during the general enrollment period. So this is for people who, for whatever reason, missed their initial enrollment period. So they still have to get Medicare. Initially, they have to sign up. And it starts January 1st. It runs through March 31st. And this is when you can join Part A or Part B, and you might have late enrollment penalties if you're using the general enrollment period, because we're saying that this is for people who missed their IEP, their initial enrollment period, right? So if they have to pay for Part A, or anybody looking for Part B that doesn't qualify for a special enrollment period, if you've missed those for 12 months or a year, then you might have to pay the higher premium. So you might have late enrollment penalties if you use the general enrollment period to get Medicare. Also, it's important to note that the enrollment period runs from January to March, but your coverage doesn't begin till July 1st. So if you don't have another source of health insurance, you could have a gap in coverage, right? Even from the time when you enroll until July when that coverage would kick in. So you can enroll in Part A or Part B during this 3-month period for January through March. And then if you enroll in either of those, you could also use April through June. So April 1st through June 30th, you can sign up for a Medicare Advantage plan, or you could pick up prescription drug coverage, what we call Part D, and make those changes through the months of April through June. And then all of that would become effective. Your coverage would start on July 1st. But again, for the general enrollment period, the thing to remember is that you might have to have late enrollment penalties, because if you're using this time period, it means you missed your IEP or your initial enrollment period. For slide 51, the Medicare Advantage open enrollment period occurs during the same time, right, January 1st through March 31st. But you can, only people who are in a Medicare Advantage plan can use this. And they're using it to switch plans. And they can only use it once within this time period. So it's just one change. And you can drop a Medicare Advantage plan and return to original Medicare. You would want to make sure that if you do that and your Medicare Advantage plan has drug coverage, then you could also take the opportunity to enroll in a Part D plan to make sure that you still have drug coverage. Or you could switch Medicare Advantage plans from one provider to another. And that one change that you make between January 1st to March 31st, that change or the coverage for the new plan would begin the first month after you enroll. All right, and then on slide 52 is a special enrollment period that we're seeing that people have more and more interest in because there are a lot of people that are working past age 65. So they're continuing to work even after they're eligible for Medicare, because remember, you can sign up at 65. You don't have to be retired. In those cases, though, there's a special enrollment period that as long as you're actively working and covered by your health insurance from your company through employment, you don't have to enroll in Part B right away because you're already covered, right? That might duplicate some of your health insurance coverage through your employer. So this special enrollment period allows people to delay their Medicare enrollment and not have to pay those monthly premiums without worrying about a late enrollment penalty. So they have anytime while they're working, when their month of retirement or their GHP coverage ends, meaning their group health plan through their active work ends, they have 8 months that they can join Medicare and not have to worry about a late enrollment penalty. Okay? So that's an important distinction there, that 8-month SEP. And then on the following slide, there's some other circumstances on slide 53 that different special circumstances that can qualify you for a special enrollment period. And some of those apply more to Medicare Advantage. For example, if you move out of the planned service area, or maybe you qualify for both Medicare and Medicaid based off of your income or resources, and sometimes that's called dual eligible, then you have special opportunities to enroll or change plans. If you qualify or change your extra help status, which means that you've qualified based on income and resources to get help with your prescription drug costs. So these are all examples of other things that could happen that could qualify you for a special enrollment period for Medicare. All right, and with that, we're moving on to a check your knowledge for enrollment period, slide 54. Carrie, did you want to walk them through this one?
Sure. And in the interest of time, I'm going to go ahead and read through this and get on with the next portion of our presentation. Okay, so let's see. Your friend tells you he's looking forward to the yearly open enrollment period so he can sign up for Part B since he missed his initial enrollment period. What do you say? Do you say, no, the first option, you'll need to wait until the next general enrollment period? Or 2, that's a great plan. And the answer is, ding, 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 you'll need to wait until the next general enrollment period, which is January 1st through March 31st. You cannot sign up for Medicare Part A or B during the open enrollment period, which is that October 15th to December 7th. Okay. All right. So next, I'm on slide 55, and we're talking about automatic enrollment based on disability. So besides being eligible for Medicare because you turned 65, Medicare also covers 2 additional groups. People with ESRD who meet special SSA earnings requirements. People with ESRD don't need to be entitled to Social Security benefits to qualify for Medicare. However, they are also entitled to disability benefits, so they could qualify under both programs. We'll be discussing ESRD in just a second on the next slide. The other additional group is people under 65 with a disability who have been entitled to Social Security Disability Insurance, or SSDI, as many of us refer to it, benefits for 24 months. In most cases, you must be entitled to those benefits 24 months before Medicare can begin. And since there's a 5-month waiting period for SSDI, the earliest that Medicare can start is usually that 30th month after you become disabled. There are 2 exceptions. There's a 5-month waiting period for cash benefits, and that doesn't apply to people who get childhood disability benefits or to some people who were previously entitled to disability benefits in the last 5 years. The other exception is that the 24-month waiting period for Medicare doesn't apply to people with ALS, which is Lou Gehrig's disease. They get Medicare the first month they're entitled to disability benefits. Okay, moving on to slide 56. You can enroll in Medicare Part A and B based on end-stage renal disease at your local Social Security office. Social Security will need your doctor or the dialysis facility to complete a special CMS form, and that's indicated in your notes of your slides, to document that you have ESRD and that you can get Medicare. The form is sent to Social Security before you apply, and the office might contact you to see if you want to complete an application. So Medicare is the secondary payer of benefits, and I know, as we said, we'll be talking a little bit more about the coordination of benefits tomorrow, but while we're talking about ESRD, Medicare is the secondary payer of benefits for the first 30 months of Medicare eligibility for people with ESRD, and we call that the 30-month coordination period. If your group health plan coverage will pay for most or all of your health care costs, for example, if it doesn't have a yearly deductible, you may want to delay enrolling in Medicare Part A and B until you're getting near the end of that 30-month period. If you delay enrollment, you won't have to pay a Part B premium for coverage that you don't need yet. So these are just decisions that a person would have to make depending upon their personal situation. And after that 30-month coordination period, then you should enroll in Medicare Part A and B. Okay, so next slide, slide 57. If you have a disability, if you have a disability, you have the same Medicare health plan choices as people who are eligible for Medicare because they're turning 65 or they're older than 65. You can choose Original Medicare, a Medicare Advantage plan, or another Medicare plan available in your area, like possibly if there's a Medicare cost plan in your area, maybe a demonstration or a pilot program, or a PACE program, which stands for Programs of All-Inclusive Care for the Elderly. You can also join a Medicare drug plan. Enrolling in a Medicare drug plan is definitely an optional choice, but it could provide significant savings for people that have a chronic medical condition. And as we've mentioned before about time frames, remember, if you decide not to get Medicare drug coverage when you're first eligible, you'll likely pay a late enrollment penalty later on if you choose to join later. If you have ESRD, you can now enroll in a Advantage plan or a Medicare Advantage plan that includes drug coverage during open enrollment. Most Medicare Advantage plans offer drug coverage and must cover all of the services that Original Medicare covers. Okay, and your costs, some of your rights and protections or choices, if you're in a Medicare Advantage plan, may be different. So some plans might offer extra coverage like vision, hearing, or dental. Okay, this is a slide where it basically discusses when Medicare coverage starts based on end-stage renal disease. And it's a good reference as well. So Medicare coverage usually starts on the first day of the 4th month of a regular course of dialysis. And coverage can begin the first month of a regular course of dialysis treatments if you meet a couple of conditions, and that is you participate in a home dialysis training program that's offered by a Medicare certified training facility, and that has to occur during your first 3 months of your regular course of dialysis. And you're also expected to finish the training and be able to do your own dialysis treatments. Coverage would begin on the first day of the month. If you get a kidney transplant, it'll begin the same month. If you're admitted to a Medicare certified hospital for a kidney transplant, and your coverage would start 2 months before the month of your transplant if your transplant is delayed more than 2 months after you're admitted to the hospital. We are wrapping up our Understanding Medicare Day 1.